occasion of World Health Day, Chandigarh University organized Sanjeevani 2026, focused on free checkups, doctor interaction, and spreading awareness.
I would like to share with you that in cardiovascular and thoracic care, we have like a lot of new technologies coming up, and there has been a drastic change in the management of cardiovascular disease. And from the time when I was a resident in PGI, and after that I was in the faculty also in PGI, and then I worked in Fortis and Max. And now I am chairman of cardiovascular surgery in Paris Health. So I had the opportunity to visit Top Ireland and also Pittsburgh University, and then visit Heart Center Germany and Pulmonary Hospital in Shanghai. So all those are the topmost hospitals of the world, and I would be very happy to share with you that India is not far behind. Like, India is considered number one in beating heart surgery. So in beating heart surgery, we don't stop the heart and we do the surgery while the heart is still beating. It's just like you repair the engine of a car on a moving car. So we are far ahead of the West, because in most of the top centers, even in US and Europe, they still do the surgery on pump by stopping the heart. While since 2004, we have been doing all our surgeries, bypass surgery in the CUTMI, in heart failure, we have been doing it on beating heart. And I had the opportunity to train with Dr. Jonas Bonatti for robotic also. But I will not say that robotic is the best option for cardiovascular diseases, especially for a lot of precision is required. The artery is just 1.5 millimeter in Indians. Many Indians, they have just 1 millimeter diameter artery, and we have to bypass that artery. So to achieve that precision, we are still far behind. And India itself has launched their own robot called Mantra. So there was a launch of Mantra 3 also last year, and now we have a robotic surgery conference at this weekend also in Delhi. So they have even performed like surgery from remote. Like, they did a gallbladder surgery across almost 10 kilometers. And last year they were trying to perform a surgery in Jaipur while the surgeon was in Delhi. But in the middle of the procedure, they had to abandon it. So slowly, maybe in the coming years, we might be able to make it a much better procedure also. And technology-wise, the application of artificial intelligence is growing day by day. So we don't have to struggle to keep the record of the patient now. Within a split second, we can get the entire record. We can get the trend also of the investigation. We can even predict which patient will go into heart failure, which patient are likely to go into arrhythmias. And we have a lot of new things coming up. We have telemedicine, in which we can even diagnose the disease from a far off area. And even like in artificial intelligence now, applications are coming by which we can size the valve of a patient, which has to be replaced according to the patient's height, weight, and other requirements and the dimensions of the heart. There is a virtual lab in Gurgaon where you just show the report. Like, if you show the echocardiography report, they can reconstruct the virtual image of the actual diseased heart. And there are virtual instruments by which you can even perform a virtual surgery before going for the actual surgery. So if you are going to perform a very complex surgery, you can first perform the surgery virtually to see what problems you will face before you actually go and open the patient. So for the management of cardiovascular diseases, the surgical part, I give a very common example, simple example, that like in the armed forces, we have the army, we have the navy, and we have the air force. Similarly, for performing the cardiac surgeries, the army is the open surgery, where you open up the chest and you do the surgery and you come back. And then if we talk about the air force, we are doing videoscopic surgeries. We are doing uniportal pads in which by just inserting a single port, we can insert the camera as well as the instruments through the same port, and we can perform the surgery wherever we want to perform, and then we can come out without actually opening up the chest. And then we have the navy. The navy is the part played by the cardiologist where you go through the bloodstream, and through that you pass a guide wire and reach your target, and there you do the surgery. You can put the stenting, you can do the endovascular procedures in which we can even put a stent in the aorta. So by that we can avoid doing long surgery.
I would request all the youngsters to follow a healthy lifestyle, take care of their heart, find out their risk factors before the disease actually creeps in.
Because prevention isn't just better, it's smarter.